Hello, everyone, and welcome to Vaccine Passports, a path to the new normal. My name is Carmel Shachar, and I'm the Executive Director of the Petrie-Flom Center for Health Law Policy, Biotechnology, and Bioethics at Harvard Law School. The Petrie-Flom Center is delighted to partner with the Edmund J. Safra Center for Ethics at Harvard University to bring you this event. This is going to be a really interesting moderated discussion on digital health passes, COVID vaccine certificates, also colloquially known as vaccine passports. We'll be toggling through all of the different terminology, and in fact, that may be a question that our panelists will discuss in a few minutes. Before I get to the meat of the discussion, a few housekeeping things. First of all, it's a moderated discussion, so please submit your questions throughout this entire event. I will be pulling those questions and posing them to the panelists. You may be asking, how do I submit questions? The best way to do it is to use the Zoom Q&A feature, which if you scroll towards the bottom of your Zoom window, you'll see a little button marked Q&A. Just type your question in there. I'll be checking it very frequently. You're also welcome to join the conversation or submit questions on Twitter using the hashtag #VaccinePassports. Again, that's hashtag #VaccinePassports. If you do submit a question there, Petrie-Flom staff will be monitoring it and will pull it into the Zoom Q&A feature. Ways that you should not try to submit questions. The raise your hand feature on Zoom, it's really cute, that little hand, but we will not be checking that little hand, so please don't try to use that. As well as we've turned off the chat function so that our panelists can really focus on what's going on. So that's not going to be a venue for you to submit questions. If you are interested in this event and interested in other health policy, bioethics, biotechnology topics, we strongly encourage you to sign up for our newsletter, to read our blog, The Bill of Health, which features some really cutting edge commentary by legal scholars, ethicists on the hot issues of the day, which often do include topics such as COVID-19 and COVID-19 vaccines, as well as to check out some of our upcoming events. The Safra Center also has an amazing event, news, and education program. I strongly recommend that you visit their website at ethics.harvard.edu or find them on Twitter at Harvard Ethics to check out their offerings as well. In fact, shortly after this event, we will be putting out a joint document walking policymakers in the US through questions that they should be considering from both an ethical and legal perspective as they consider whether to implement vaccine passports or allow the implementation of vaccine passports within their state. So please keep your eyes peeled for that, as well as further conversation on this topic on our blog, The Bill of Health. With that, I am going to launch us into the meat of the subject. COVID-19 immunity passports or certification programs have been floated as a way to get us back to the quote unquote normal, to allow people to return to work, to travel, to go to restaurants, to go to concerts. But they've been incredibly controversial because they touch on issues of equity, they touch on issues of distrust for vaccines or vaccine hesitancy, they touch on issues of individual autonomy. The legal issues and implementation issues are very complex. There hasn't really been something of this magnitude tried before. So it's really been on the lips of pretty much anybody who's working in public health, health policy, bioethics these days. There's been a lot of great information written on the topic. And in fact, it's been very fast moving. This morning, as I gathered the panelists, we were discussing a bill that is working its way through Montana that recently sprouted up. Of course, things are happening in places such as Florida and Texas and Arkansas, but also The regulators are talking to their US counterparts about how to make this workable. And we thought that it would be good to have a panel of people who come with different perspectives and different competency to this topic. Speaking of these panelists, I have the pleasure of introducing them. We have Glenn Cohen, Faculty Director of the Petrie-Flom Center, as well as James A. Atwood and Leslie William Professor of Law and Deputy Dean at Harvard Law School. Natalie Koffler, Senior Advisor at the Scientific Citizenship Initiative at Harvard Medical School, as well as a visiting fellow at the Edmund J. Safra Center for Ethics at Harvard University, and founder of Editing Nature, which is a fantastic website. I highly recommend you check it out. We have Iris Goldner-Lang, the Jean Monnet Professor of European Union Law and UNESCO Chairholder at the University of Zagreb Faculty of Law. And last, but certainly not least, Seema Mohapatra, Associate Professor of Law and Dean's Fellow at Indiana University Robert H. McKinney School of Law. Glenn, Natalie, Iris, Seema, I'd like to welcome you to the conversation. And I'm going to throw the conversation open with a question that is addressed to all of you. Can you articulate what are the main challenges and benefits that digital health passes or vaccine passports pose? Why are we talking about these kind of programs?
Why don't I start on the benefits side? And here, I'll just say that while there's a lot that's exceptional here, there's actually a lot that's not exceptional. I think it's good to frame it this way. In that anybody who's traveled to many parts of the world know that that little yellow book with your proof of yellow fever vaccination or the like, very commonplace. Anyone who's had a kid in school knows that many public schools require you to show proof of vaccination. And indeed, in this country, if you look back to the turn of the century, the smallpox epidemic, we had a huge amount of soft mandates, show the scar, show that you were inoculated by employers, public spaces, schools. Okay, so why the heck have we done this in the past and why do we do it now? The idea is to improve public safety and also, and this is important, as a less restrictive alternative compared to a background rule where people would be in further lockdowns, where particular institutions would be shut, including universities. So it's attractive for that reason. For me, the biggest concerns are, can we do it in a way that is equitable, that is safe, and that maintains privacy? And here I think, and we'll talk about this, and I'll let the other panelists jump in, the equity issues are both domestic in terms of racialized minorities and vulnerable populations and people with disabilities, but also international in terms of access to vaccines for low and middle income countries. And the privacy concerns are worsened by the sense that right now in the US, we're talking about a fragmented system of many different apps as opposed to one that's run by the federal government.
I'll just jump in. So I think one of the things that people have been thinking about with vaccine passports or digital health passes has been kind of this conflict or how to balance liberty versus kind of equality or equity concerns. And liberty meaning, where you're allowed to do, things opening up, whether it is, something like going to a concert or a sports event or, crossing borders, international borders, or, things like going to work, going to your university or school. I have been focused in the last year with Professor Akaya Yurbi on lots of issues of racial equity that has come up during this pandemic. And as the discussion has kind of focused more and more on vaccine passports, part of the concerns that I've had, and many of you on this panel have shared those kinds of concerns, are that when we try to look for a technological fix for what has been kind of a ethical, disaster in terms of inequity, it doesn't seem, to me, what I'm worried about is kind of the focus shifting. And so I do draw, and I know we'll talk about this, I do draw a distinction tension between requiring vaccinations for schools, like has been done for many years, and when we are thinking about members of society being able to, like a vax pass like Chicago, in a city that's so segregated, and that we know that access to vaccinations has been limited, even though everyone technically over 16 can get vaccinations. So I know we'll discuss that, but as a framing.
Iris, would you like to go, or I can jump in and then we can maybe move to Europe for
No, please go ahead, because Europe is a kind of separate, yeah.
So I want to actually kind of echo and refute some of the things I've already heard. I agree with Seema. I think that these inequities that we've witnessed throughout this pandemic are continuing now, both domestically and internationally. And I have a lot of concern that programs like broad use of, a vaccine passport to be able to access leisure and everyday activities could very, very much run the risk of codifying those inequities. And I also want to just push back that I do think there are some new, that there isn't necessarily full precedent here. We know about the yellow fever card, that it has been in place for quite some time, but both from a scientific and ethical standpoint, there's some big differences to what we're talking about now with this COVID-19 pandemic and vaccines. One is that there's only really a single yellow fever vaccine. It's been around since 1938, and there's only 4 producers that are recognized by the WHO internationally. There's a completely different scenario going on with vaccines globally right now, in that, there's, I think, 19 different vaccines registered at the WHO at various levels of authorization. We know there's huge inconsistency in efficacy, not even amongst vaccines, but also amongst manufacturing locations for even the same vaccine. And so, if the goal here is to protect public health, a vaccine passport might not actually accommodate and effectively do that in the way that a yellow fever card can. And I just also want to push back again on the motivations for a yellow fever card. Right? Yellow fever cards are very much used at this point to protect individuals from traveling to places where yellow fever is endemic. There's a secondary, use there where it's also to allow that those travelers might not carry yellow fever to new places where those mosquitoes that carry yellow fever are there. But this is a global pandemic, and the issue here is really about protecting communities. And so we need to make sure that if we're allowing vaccinated individuals to travel to places that have low vaccination rates, are they actually protecting those communities from transmission, and also further hindering those very people who have been disenfranchised by inequitable global vaccine distribution. So I'll just stop there and then and pass it to Iris.
Thank you. So to complicate things a little bit more, I will give you a European perspective. And I agree with Glenn, basically, that the crucial issues are about, discrimination or non-discrimination, prevention of more restrictive measures. And when it comes to the EU, there is a third element, which is free movement, free travel across the EU, which is not a problem, so much of a problem in the US, and the need to coordinate. And all these 3 issues are at the same time benefits and challenges, at least in the EU. When it comes to coordination and free travel, this is what these so-called digital green certificates, the way they are called in Europe, are supposed to be, to enable free cross-border travel within the European territory, primarily for EU citizens, but to a certain degree also for third country nationals like US citizens. And that's beautiful. That's very important, considering that the whole pandemic has been the biggest ever challenge to the viability of the EU internal market. We have never had such a threat to the functioning of the EU free movement. So this is a positive thing, and it's also very positive that this is now coming from the EU. So the initiative to regulate this issue is coming from the EU level. And so far, we have had really an amazing number of very diverse and quite often inconsistent national measures, which were neither agreed nor coordinated at the EU level. And at the same time, this is also a challenge, because what the European Commission is saying is, well, this is going to enhance safe cross-border movement. And we still don't know that, because there are so many scientific uncertainties that are linked to COVID-19. We still don't have scientific data which affirm that really the individuals who will be traveling will have really minimal chances of transmitting the disease to the non-vaccinated ones. And as regards the discrimination issue, well, I think that's done quite well at the EU level, because the EU certificates will enable movement not only of the people who have been vaccinated, but also of the ones who haven't been vaccinated but have a negative test or have recovered and have antibodies. And that's beautiful, that's positive. Otherwise, it would definitely be contrary to EU law. But the problem is that if you look at the numbers in the EU, in terms of what percentage of the population has been vaccinated across the EU, the numbers are extremely low, and there are huge disparities among member states. So the consequence is that if you had the digital green pass today in the EU, I think it would be simply too soon, because a lot of people would find it unfair, despite the fact that there would be an alternative, and quite, a good alternative, I would say. They would simply consider this to be unfair because they want to get vaccinated, that yet haven't had a chance to get vaccinated. And then a lot of member states might consider this to be discriminatory because there are such huge disparities in terms of the percentage of the fully vaccinated individuals. In Latvia, it's only 1.8% of the total population. On Malta, it's 20%.
So I want to pick up on a thread that Iris and Natalie mentioned in their opening remarks, which is the scientific uncertainties around COVID-19 vaccination, what we do and what we don't know. This panel has a lot of lawyers, but we do have a little bit of scientific expertise. So Natalie, I'm going to ask you, what are the scientific complexities and challenges of implementing digital health passes?
Yeah, I think it's a really important question, obviously, in the production of evidence-based policy, right? And I think, it's part of where I'm nervous. What I'm nervous of is, the vaccines, and for good reason, have been sort of discussed as being the silver bullet to getting out of the pandemic. But there's still an incredible amount of uncertainty about just how this virus works, of course. And then, of course, the level of efficacy of these vaccines, not so much in preventing severe disease. We know all of the approved vaccines, at least within the United States and the EU, are very effective at preventing disease. But it still remains to be determined their level of efficacy in preventing transmission. And that is absolutely fundamental to a successful vaccine passport program. There's preliminary data coming out of sort of the Pfizer vaccinated population of Israel and other places in the EU, in Europe, and in the United States that show that, Pfizer's vaccine seems to be quite effective at preventing transmission to some degree. However, this can vary across individuals, as well as the AstraZeneca vaccine seems to be quite effective. But again, these studies are being done in the context of certain specific populations and in the context of specific variants. And this is where sort of things get also even more complicated, when we start to think about, is transmission really protected when we are in the face of different variants? It'll be interesting to see, we have new variants that have emerged out of India that have multiple mutations that we're seeing creating horrible levels of suffering and death in India right now. And so things can be changing just really quickly. And I think that that's going to be a real challenge with policy, is can you make a program that is, reflective of that fast changing and nimble enough to really make sure that you're protecting communities.
Can I pick up on that, Carmel, and just say that I think that, to me, this is one of the things that shows the failure in the United States compared to other countries about our ability to track vaccination rates and the like, and to keep records on this, because I view these passports as kind of a backdoor way of collecting a lot of information that's really crucial to know things about durability and the like. And I know there's all sorts of reasons for privacy people to be nervous about exactly this bug in it, but there is also a feature aspect. And compared to our peer countries, we have a much less good surveillance system in terms of understanding who's been vaccinated, where vaccination is, how that is mapping on to variant emergence. And I think this is something that's really unfortunate in the US. And as we think about the next pandemic, it might be an area where there is some interest in trying to build a much better surveillance system.
Yeah, and I think, sorry, one last really important point in any sort of vaccine passport is how long is it going to be valid for, too, right? And here's another sort of difference from the yellow fever card. The yellow fever vaccine gives lifelong immunity. And we're very unsure how long immunity is going to last with these vaccines, maybe up to 2 years, but it's likely also to differ across individuals. And so again, that's a question there of really how often is this going to have to be recredited and revalidated, or the need as boosters arise as well.
If I could just jump in for a second. Oh, sorry.
Oh, go ahead.
I just wanted to just add a bit of, in terms of the equity issues that have been brought up in terms of global equity. I think that also is very related to the scientific, the variants. And I have in my own family, my uncle right now, who's a cardiac surgeon and was one of the first people that were fully vaccinated in India. He is suffering right now from COVID-19. So I know personally, he is one of the, 1% of the population that's been fully vaccinated that now is infected. And it's really hard to think about, these vaccine passport or digital health pass systems without thinking about it in a global context. So often we look at in the United States, we look at things just from a US perspective, but we're seeing this whole coronavirus pandemic. We saw the fact that we were ignoring what was happening, in the beginning of the pandemic, what happened because of that. And I worry that when we kind of focus on, well, let's get back to normal, we are not going to actually end the pandemic if we're worried, if we do not focus on the countries that need it and to make sure that the science is there behind it before we have, if a COVID passport is even practical, right? If it even works.
So, Seema, that is a sobering reminder that getting a COVID-19 vaccination, while very important, and everybody should if they have access to it, it's not a you're at home base and completely safe. So, Glenn, I'm going to pick on you because you opened the door to data and privacy questions by mentioning the US's approach to healthcare data. And we, in fact, have some data and privacy questions from the audience already. The first one is that privacy concerns are frequently mentioned with respect to vaccination data. But why should this data be private at all? And this attendee references that most of us seem comfortable sharing vaccination status online with virtually everybody. I know that I have seen friends' CDC vaccination cards pop up on social media. I have seen the vaccination cards of like the daughters of Real Housewives pop up on social media. I do not know these people personally, but I have now seen their vaccination status. So why should we care about privacy in the context of the app when so many people are not treating this as very private data at all?
So let me start by making a public service announcement to all the Real Housewives who might be watching the Petrie-Flom Center today, which is to say the vaccine card may contain a bunch of identifying information about you that might make actually identity fraud a lot easier. So that's a reason not to do it unless you've blacked out all the elements of that. So that's just something to say out there, PSA. Okay. So the fact that you've been vaccinated, that's not like top secret information. I think the place where people are a little bit more worried is any system. I think here we're all in agreement. Any equitable system has to figure out what to do about people who have medical contraindications. They're not a huge amount of the population, but have a reason not to be vaccinated that's related to their health information. And there is a concern that if the vaccine, digital health pass contains details about that, or even the fact that you are a person with a disability, that's an area or space where we might think that there is more privacy concern. And the idea of the stigmatization or targeting of people who have not been vaccinated, who may have many reasons, some of which I think we would not support, but others we might think of as reasons that are theirs that are justifiable and the like. So there's a way in which you might expose the whole kit and caboodle if all of that is built into the vaccine passport. I will say on the flip side, one thing that's very nice about the passport, just recording whether you've been vaccinated or not, and perhaps the type of vaccine you received and the date of vaccination, is it avoids your employer or others asking a lot more questions. And this is something in the EEOC's guidance that I think is quite right, that it avoids the need to engage in a health information discourse that might be a disability related inquiry if we have this information in a simplified form. So you're vaccinated, okay, we're good. And we can stop asking people lots of other questions. So there is a way in which it might also be privacy protective, but I think where I get nervous is not so much your status of vaccinated or unvaccinated, but to the extent in which we're capturing information about why you're not vaccinated that might reveal information about you. Now, one more thing I'll just say is, for me, this is a good reason to have a single, unified, super cyber secure system that does this, rather than having 25 of these floating across the United States, where you have to be represented in each of them, and some of them have great cybersecurity, and some of them are some fly-by-night startup that's doing this. And I think in that respect, it would be great if the federal government took on this aspect of building the highway, even if they don't want to enforce the rules of the road.
Can I just jump in? Well, at the EU, in the EU, even though we are supposed to have this EU digital green certificate, this will nevertheless not mean that the data will be centralized. So, the EU is very much about data protection and privacy protection. So there are huge concerns about this. So they emphasize that just the basic information will be provided there, that the person or the machine that is having access to these personal data will definitely not be entitled to retain the data, and data will not be centralized. So how this is going to work, whether it's going to be a complete mess or not, nobody knows. I know that there will be a pilot starting in May. The idea is to have these digital green certificates in Europe adopted and functioning either at the beginning of June or in July, which is pretty soon. And they want to have a pilot in May, and a lot of member states, including the state where I come from, Croatia, have already said that they are interested. But how it's going to work, I don't know, because certain states like Estonia are very developed in terms of, having real experience with such types of usage of digital documents and so on. The others are not that advanced, and some are already using certain types of certificates. Like, for example, Denmark, it has something that is called the Corona Pass, which is already used as we speak today for accessing a hairdresser or something like that, and they intend to use it even further. And not everybody is satisfied, but it's working in Denmark. And Sweden has said that they intend to do something similar. And then France has had a trial for people traveling via Air France to one of its islands. So some states already are gathering experience, while others are not. And there are certainly huge data protection concerns in Europe.
And I'll just jump in that also with both of those, the privacy and the data protection concerns, I think one of the worries about, a national vaccine passport system in the United States, or even state or private actors, is once that infrastructure is in place, what else is it going to be used for, and what unintended uses are there? And so, I agree here, if there are going to be vaccine passport schemes, that we do need to make sure that there are protections and that there's right now, there aren't laws that protect the use of that kind of data in ways that we might not anticipate, because, you know, HIPAA doesn't apply and we don't have a all-encompassing privacy law like GDPR. And so there are concerns about that we cannot anticipate the way that data is used. And I wouldn't, you know, to push back on Glenn's comment about the fact that it could be privacy protective in terms of employers not having to, you know, ask questions about that it might be disability related. Well, it is going to relate. It is going to lead to disability related inquiries, because if you didn't get a vaccine because of disability reasons, you are going to, you know, need to have, you know, show why, you know, if you need an accommodation or whether or not it's reasonable or not. And so I'm not sure that it is as protective as he mentioned.
So I think Iris has done a great job of highlighting the patchwork of approaches and experiences found in the EU. And I want to throw out to the entire panel, who are the key stakeholders in developing these apps? Who is pushing this forward in the US, in the EU, globally? We have a question from an audience member asking if there is a global vaccine passport program supported or managed through the WHO, for example.
I mean, so I can say, at least at the WHO level, there's international health regulations that oversee, say, the use of the yellow fever cards at this point in time. And to be clear, the WHO is currently not endorsing the use of vaccine passports, but that can change. You know, that's sort of a moving target. I would say I can speak for the United States, that in the United States, it seemed like the really early on sort of activators of this space were kind of two kind of groups and sectors. One were sort of the technology companies that were already using certain digital identification features for other things like financial technologies and things like that, and then sort of trying to pivot into this vaccine space. So we started to see those sorts of moves. And then the other are sort of some of these big sectors or organizations, private sectors that think this can help them to reopen their businesses, right? So places like Ticketmaster, American Airlines to allow for travel. The NBA has been active in this and thinking about how they might allow people to be able to go to their basketball games. And so we've seen a lot of action, actually more, I would say, in the United States in the private sector, and then either some partnering with public actors, but mainly privately driven. And that's where some of these questions of privacy and equity do come up, as Seema brought up, that many of these apps, for example, wouldn't be HIPAA protected. And so you're kind of seeing, again, this patchwork. I think there's what now, Carmel, like 17 different apps under development in the United States, all with different operating systems and different levels of privacy.
So here I just want to jump in because Natalie, both you and Seema have mentioned HIPAA, and either of you can answer this audience question. We have an audience member who wants to know, why doesn't HIPAA apply to these types of vaccine passports?
So HIPAA, when we are thinking about HIPAA protection, even though we're all familiar with it because, when we go to the doctor, we sign a privacy, a HIPAA form, unless you are either in the business of, payment, treatment, or healthcare operations, you are not going to be subject to HIPAA. And so, then you're not a covered entity. And in this case, the vaccine passport schemes as they are being proposed would not be subject to HIPAA protection. And so we don't, that is why, because it's not going to be for, that information is not going to be for payment, treatment, or healthcare operation purposes.
Yeah, and so I think the thing here too that happens is you see an argument that's like, this is good. This empowers individuals to be in control of their own health data, and this is something that people desire. But that's only goes hand in hand with an level of education to understand what is being done with your data and how this is being used. And I think we also have to think about this on a global context too. So what does it look like if me, once I ever become vaccinated, I'm in Canada, so I'm like really slow to get vaccinated up here, but when I do become vaccinated, if I want to travel to a country, like China, where they're going to want my vaccine passport, how am I sharing my data to enter those countries, and how is that data being used? And then of course, domestically, what is the NBA going to do with my data when I want to go to the Raptors game? And so these are, I think, things that, just even myself, I'm not even well aware of, and things that, the government really could step in to help starting education campaigns on privacy of people's own, on protecting our own data.
And can I intervene here? Two things. One is just to amplify something that Natalie said, which is to say one of the so the Biden administration doesn't want to touch this issue with a 10-foot pole is the truth of the matter. And there's a lot of political reasons why that might be the right thing for them to do as an administration. But the effect is that we're going to have private sector individuals controlling a lot of data. We could have a national authorization, a legislative authorization, or an executive order that created these and also extended protections for privacy concerns, information on the data if we had a single system. And to me, that is a missed opportunity. The other point I want to make is just more conceptual, which is to say, I think there are two separate conversations and they're interesting, but they're a little bit different. One is it proper for institutions like universities, like employers, like public schools or not, to require proof of vaccination or some other thing as a condition? And then the second is a vaccine passport system a good way to do this, right? And some people are just opposed to the first, right? So if they're opposed to the first, they're not going to like the vaccine passports. But there's a group of people who think it's perfectly acceptable for the correct institutions to react in the correct ways about setting up these requirements in the name of public health and public safety, but who are resistant to the idea of a vaccine passport as opposed to a more analog system. And I think it's useful to disentangle those two sets of kind of objectors, because you asked about civil society. I think some of the people who are objecting to vaccine passports are also objecting to mandates, and there's other people who are actually fine with certain kinds of mandates but don't like this way of achieving them.
So Glenn, your question, oh, please go ahead, Iris.
Well, I just wanted to explain who are the actors in the EU. So in the EU, I would say that there are maybe 3 layers of actors. So it's primarily, first of all, it's the European Union, which is kind of the federal level, even though the EU is not really a federation. And what they do now with this initiative to regulate and adopt the digital green certificate, they're using the legal basis, which is the EU free movement law. And this is so because they're very limited. The EU has very limited competence to regulate public health. So the European Union can only complement and coordinate national actions in relation to public health. However, when it comes to the EU internal market, the EU shares its competence with member states. And it also has preemptive powers, meaning that once the EU has regulated a certain area in the area of free movement, then member states can no longer regulate it. So if the COVID certificates are about and have an impact on the internal market, which they do, the EU is entitled to regulate. And that's exactly what they're doing now. However, what they do regulate is only cross-border travel within the EU. The digital green certificates explicitly state that they do not regulate anything else. So the second layer would be if, for example, a member state decides to use the digital green certificate for a different reason. Could they do it? Yes, they could. But then they would have to regulate it based on their national law. And when doing so, they would have to comply with EU, with fundamental rights standards and with EU free movement law, because that could have an impact on nationals of other member states who come to that member state. So here, member states could adopt something, or they could simply apply digital green certificates to something else, but then they have to regulate it themselves and they have to comply with EU law. And when they implement digital green certificates, when they create them and issue them, they can definitely rely on private companies. And I'm sure that quite a lot of them are actually going to do that. So I think that when it comes to digital green certificates, all the 3 actors, all the 3 layers will be somehow involved. It will be the EU adopting this, and member states will take part in this decision-making process in the Council of Ministers of the European Union. It will be member states who will be issuing and creating these certificates, and they will quite often, I think, be helped by private companies in this process.
So we've talked a lot about private companies, and we've talked a fair amount about the EU versus member states. One thing that has been missing from the US side of the discussion is a discussion of US states. So Massachusetts, Texas, California, etc. And I want to combine that with Glenn's unpacking of who might not like these programs and these mandates. What is the role of the states in the US, and what are the diversity of approaches being taken on this issue?
I'll start. Take a look at the electoral map. It'll give you some clues, which is just to say there are some states like Florida, I think Texas is the other one, there's another state, that have basically taken the position that we want to proactively outlaw these vaccine passports before they're ever in place, right? Now, these statutes particularly reference these passports, but they're actually, for the most part, anti-mandate statutes that we want to proactively prevent mandating this as a requirement for businesses and the like. There's other states, I think New York is on the other extreme, kind of interesting in terms of this, where like the New York governor was like one of the first to say, let's create a system and partner it, and I'm gonna show how great it is, the Excelsior system. And then I would say there's a bunch of states in between that have shown some interest or some tolerance to this, but are not particularly taking a leadership role in this respect at the moment. So that's my read of kind of the US states, but my colleagues might have other views.
I agree, and I think it's unfortunate that this topic has become so politicized, because there are real substantive issues to talk about, practical, ethical, legal issues about these vaccine passports. But at the same time, they've become this political like hot rod. And some of the reasons why they've become political hot rod are kind of not related to either the practical, ethical, or legal issues. They're, based on these kinds of no government intervention, distrust of government, any kind of government intervention in your lives. And, it also comports with some of the vaccine hesitancy that we're seeing, especially with Republican men. And so, it has become that way. It's not clear if Governor DeSantis and Governor Abbott's, kind of executive order saying that there's there can't be any vaccine mandates or vaccine passports would actually hold up. However, I just found out in our pre-session that, Montana has this legislation that they are actually considering this legislation to not allow vaccine mandates. And that's going to be interesting to watch to see, if they do that. And then in terms of, usually a state has its own public health, within its police powers, its powers to regulate for the health and safety of its citizens. This is kind of the opposite, because we are, you cannot argue that not having vaccine passports is for the health and safety, right? Because there's no scientific argument based on that.
I would also just say, I think part of the problem here too is the motivations of such a passport, right? So, let's be clear here. The motivations are very much economic, which is fine. Like that, there's obviously value to that. I'm not saying there isn't. But what's concerning to me is that, we are still in a pandemic. And right now the motivations has to be protecting communities and reaching community level immunity as fast as possible across the world, right? That has to be the goal for this thing to go away. And so in a highly polarized, politically polarized country like the United States, having some foresight on how discussions on vaccine passports might have shifted states to refute mandate, to bring in refutation of mandates. Like that's a scary thing. And I think the other thing that's scary, and there's some data, it's all kind of mixed data, some people might be, a vaccine passport might actually promote them to go get vaccinated, but there's also going to be a huge contingency in the United States that being told they have to have a vaccine passport is actually going to dig their heels in the ground further to not get vaccinated. And so I think there's things here that we have to be very careful about. And it might be that, the ship sailed and there's not sadly any way to kind of rein it back in.
And if I can add just one more point to unpack this, and this is based on work that Natalie and Seema and others have done, is that vaccine hesitant or vaccine resistant, these are very large categories, and it's really important to figure out, is this a person who's a racialized minority that's concerned about being over-policed? Is this somebody who would love a vaccine but doesn't have time off from work or doesn't know how to get this? Or is this somebody who is politically opposed to the idea of being vaccinated or mistrusts the vaccine? And how many people of these people can we meet where they live rather than treat them as an omnibus category that is kind of subject to demonization? I think it's really important, but it's difficult to talk about in terms of science communication to recognize there are so many different flavors and what they need to join this conversation, to be part of this goal to keep everyone safe and to protect everyone in the world. It turns out they need different things.
In the European Union, you can also see different states reacting differently to these types of certificates. States like Belgium and the Netherlands and Germany have shown, at least to a certain level, discontent with the idea of the EU-wide regulated certificates. And what is interesting is that we talked at the very beginning of this panel that the idea behind these certificates is to prevent more restrictive measures. And that's exactly what is the logic behind the EU digital certificates. But what is really amazing and paradoxical is that the proposed EU regulation will nevertheless leave the possibility to EU member states to adopt more restrictive measures. And then they will have to notify the Commission and other member states and give reasons. And my personal belief is that the likely reason behind this is that some member states have shown discontent with this proposed regulation. So the Commission, the European Commission, is trying to compromise and probably to increase the likelihood of this regulation to be adopted. So it leaves the possibility to member states, nevertheless, to adopt stricter rules if they so choose and provide adequate reasons.
So one theme that has come up in the audience questions is sort of the difficulty of tying these mandates or programs to the reality of where the vaccines are now. And this has been expressed by asking questions such as, can you mandate that somebody get a vaccine that is currently under emergency use authorization, to use the American term, as well as concerns about, well, there are many different vaccines out there and some of them have been approved in certain countries, but not in others. So AstraZeneca is the most prominent discrepancy between the EU and the US, but then certainly the Russian and Chinese vaccines, which are being used quite broadly, are not approved, notably in the EU or the US. What should the implementers of these mandates and or digital health passes do to incorporate the fact that these are novel vaccines and that there's quite a lot of regulatory shift happening right now?
Okay, I'll go first then. I'll say, as a matter of federal law, you can read me making this claim. There's no difference between an emergency use authorization and a BLA and approval in terms of the legality of requiring people to undergo vaccination as a condition of coming to something. And I want to just be clear here in that many civil libertarians frame this as keep the government off my body, don't force me to do that. And that's true. Nobody's forcing you to get vaccinated, but to say as a condition of doing X, you must prove that you're not posing a risk to others or to yourself is completely consistent with the history of this country and many public health regulations. Now that said, even though that's true as a legal matter, in terms of the way it registers in people's mind, they have a different reaction to hearing something's gone through an emergency use authorization than an approval. And it's my fervent hope that at least some of the vaccines, if not all of them that we've approved, that we've authorized in the United States, move to full approval soon, because I think it takes away that one strand of the argument that I understand that people don't realize, that if there's ever been a data set that's been scrutinized to the nth degree, it's this data sets relating to vaccination. Now, the point you raised, Carmel, about different vaccines is, I think, an extremely tricky one, but it's a tricky one about the mandate part, not so much the passport part. In that, as a university or as an employer, you have to make a decision about what you will accept. Within a country, most of it, employing in some ways is easier. It's us at the university level that I think have the hardest questions, because we have so many international students. One possibility is that you required people to be revaccinated with one of the approved vaccines. That requires you, though, to find and scrounge up to make sure you have enough of that vaccine. Probably not a problem for the US right now, but a problem for many other countries that are running low. And also that you have confidence that there's no problem in having somebody have a vaccine a second time or the like. But I do think that that's a real problem. But the passports in some ways here, I think, make it, if anything, either they're neutral on the question or they're a little easier. It's because in the sense that you can at least identify with a well-designed passport system what vaccine someone has and evaluate whether it meets your standard or not. So I think the problem is on the mandate side, not so much on the passport side, but it is a real problem.
Should I just briefly explain the EU situation? Well, in the EU, there are currently 4 vaccines have received the EU marketing authorization. However, some member states, for example, Hungary, have also been using other vaccines like Russian and Chinese vaccines. And will that impact the future certificates? Yes, definitely. Because the idea is that, based on the current proposal for this regulation, member states will have to accept certificates for vaccines which have received the EU marketing authorization for vaccines. However, each member state will be able to extend this to EU citizens who have received other vaccines which have not been authorized by the EU, for example, the Chinese vaccine. So we could have a theoretical situation where a country that wants to attract as many tourists in summer as possible and would like to have as many Hungarians on its coast or wherever says, okay, it doesn't really matter. We are going to accept certificates also by people who have been vaccinated by vaccines which haven't been approved in the EU.
Switching to a bit of a different focus, I remember about this time last year, the topic that everybody wanted to talk about were exposure notification apps, also referred to as digital contact tracing apps. People were like, oh, this is kind of the cutting edge application of technology to the pandemic. There's a lot of privacy issues. We need to discuss this. And then it sort of fizzled out. There wasn't much uptake of these apps, and it just sort of became a non-issue. Does this panel think that the same will happen with digital health passes, or do you think there is a chance that they really will become a reality for many global citizens, especially Americans and Europeans?
I'll start by saying I think it's a high-class problem to have, the vaccine passports, and that in a moment when we look at our friends in India and across the world where the problem is vaccine access, like this is the problem you wish you have. You have such a large population of a vaccine, vaccinated, that this is feasible. I do think, and I'll be very curious to hear what Iris thinks. I think in the EU, this is very likely to come to pass just because the movement between member states is such a clear and important aspect of it. And I do think that they put their chips in and they're committed pretty early on this. In the US, I'm less sure whether it's possible we'll reach a voluntary vaccination rate that's high enough. And the main way this will be used, unfortunately, will be as an exclusionary device for immigration, which I think would be unfortunate. But for that, we could actually use paper documentation. We don't necessarily need the digital passport if we're talking about border control.
I think it's going to be basically, I think, I would just say, firstly, contact tracing has taken off in certain countries, right? I mean, even in Canada, we're using it to some degree, and we know in South Korea and other places like that, it's very much in use and has been really important in protecting communities. So, but I think with the US, many of the same issues arise for a variety of reasons. There's a centralized healthcare system, for example. You have huge political polarization around issues of privacy and personal liberties. And so I think in the US, it's going to be I'm not sure, but I do think internationally, we are certainly going to start seeing sort of reciprocal implementation of some sort of vaccine passport model. I'm really curious to see what's going to happen between the US-Canadian border, for example, and looking at this regionally, or the US-Mexico border. But I do think internationally, and this is something I'm scared, one added element of a real concern for me is, it's just one other way of just sort of benefiting, the rich global north. So what, we're going to be traveling between Europe and the States, and it's going to be like a great summer, while literally, and we're paying, 16-year-olds in West Virginia to get a vaccine. Whereas healthcare workers in Kenya still aren't fully vaccinated. And I think this is, when we look back, this is going to be an unbelievable moral stain on humanity that our future generations will just be, I think, outraged about. I hope will be outraged, because that's, I think, the direction we're going. And I think this has the ability to do that. And I think we have to be very, very, very careful.
Yeah, I agree with Glenn. I think that it's quite likely that these passes will become a reality in the European Union, because so many EU member states and private businesses, especially, for example, in tourism, really want these certificates to be adopted. And I think that if they do get adopted, they will exist until there is no herd immunity. So, because if you look at the proposal, it's stated that the certificates will be suspended when the WHO declares the end of the pandemic. So we might have them for quite a while. And there is another problem which is related to the functioning of EU free movement law. So once there are real and sound scientific data proving that vaccination really minimizes the risk of transmission, it could be perceived as unfair by those who have been vaccinated in the EU, not to be recognized this right, but instead forcing them to, I don't know, take self-isolation or a quarantine. So, when looking at what is the least restrictive option for a person who has been vaccinated to freely travel cross-border in the EU, of course, provided that vaccination really minimizes the transmission, then it would be unfair not to somehow recognize this to those who have been vaccinated. Otherwise, they could perceive this as a kind of a punishment, a pointless burden to their right to free movement, which is an EU right and a basic principle in EU law.
So I'm mindful that we only have a few minutes left with our panel. And so the wrap-up question for you is, if you had to tweet out one thought about vaccine mandates or digital health passes to the general public, what is it that you would tweet? So you've got about 140 characters, although I won't count every letter.
I'll go first then. Let's say, good if least restrictive alternative, comma, keep equity and privacy top of mind. I don't know if that's exactly 140, but let's do that.
I'll say focus on community health centers and getting people vaccinated and providing incentives rather than sticks.
I'm going to say, healthcare vaccine mandates, and then fire emoji, hot, 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 that's good. And then broad implementation of vaccine passports, bad. certain to increase inequity and mistrust?
I suppose I would say that EU certificates are actually 3 certificates in one, because people don't know that really. So it's vaccination, recovery, and test all in one.
Great. Thank you to all of our panelists. This was a really fascinating and really engaging conversation. To my audience members, if you want to relive the excitement, or if you want to share this with friends and family who weren't able to attend, we will be posting this recording probably in a week or 2 on the event page. The only holdup is that we like to caption our events so that people who have difficulty hearing can also see the video and experience what our panelists had to say. So one of the drawbacks of virtual events is that you cannot hear the audience applause, but you guys have been fantastic. This has been so interesting. So please accept a round of virtual applause from all of us. And thank you for participating in this moderated discussion on digital health passes, also known as vaccination passports.
Thanks so much.